Hi, I'm DrKimDeramo, physician, speaker, #1 best-selling author, and founder of the American Institute of MindBody Medicine. I am here to talk to you today about pain. Pain is a pain. There's so many people who are in pain and don't have great solutions. Now, medication offers a great solution to get people out of pain. I trained in emergency medicine, and we give drugs all the time to get people out of pain. But the most important thing that I need to remember as a physician is that there's an underlying reason for that pain. So if someone comes in with pain from appendicitis and I give them a bunch of morphine and I've turned off the pain and they're more comfortable and they feel better and they say, "Oh, great, thanks." Well, they're going to be back. There's a problem that hasn't been addressed and hasn't been resolved. And I know as a doctor that I always need to look for the root causes. I need to understand why someone's in pain and what do I really need to do. In my practice, I've gone 10 steps further with looking for the causes, the root causes of chronic pain. Pain that's not due to some organic problem in your organ where your appendix is about to explode or you have a bleed in your brain, but pain that's just been there with no apparent underlying physical cause. And one of the things I found virtually every single time I've evaluated a patient with chronic pain is that there are underlying emotional components, emotional energy, and mental, meaning different thought patterns that are locking that pain in place, preventing the body from healing itself, preventing the body from releasing that pain, no matter how hard they try, no matter how hard they work in physical therapy or acupuncture, all kinds of different medications, they can't get out of pain. And I've always found, and virtually all the patients I've evaluated this way, that we can release this pain when we do address those root causes. So I'm going to introduce you to a tool that I've used very commonly in my mind-body medicine practice called Emotional Freedom Technique. It's called EFT tapping. I was recently on the World Tapping Summit with Nick Ortner, a good friend of mine who's teaching millions of people how to use Meridian tapping to get out of pain, to end anxiety and depression and all kinds of challenges and struggle. So I'm going to guide you through that EFT tapping technique in this video specifically to release and reverse pain. Now, EFT is a way of giving new information to your brain. You're going to tap on your acupressure meridians and you're going to give new information to your brain. What you're going to be stating are just truths that you may not even be so aware of, but that are circulating in your thought pattern, that are informing your body. Your mind is constantly sending messages to your body. And if you're living in pain, it will benefit you to change these patterns, this pattern of communication between your mind and your body. Now, most of the people I see with chronic pain, there's a battle, there's a struggle. They're working hard trying to get out of pain, but that is the very thing that keeps it in place. Having experienced myself a chronic pain pattern I had for years, I understand how frustrating this can be, and this is one of the types of tools I used that has helped immensely. You're first going to start on the karate chop point. The karate chop point is right here on the side of your hand, and you just gently tap, 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 tap. Now you could just use one point, but I'm going to show you all of the points as we do the tapping. So hang with me because a lot of people say this looks really weird, but I'll tell you, if you're in pain and you're ready to get out of pain, you are going to love this tool. The next point is right here on your inner eye, and then outer eyebrow, just tap, tap, tap. Underneath the eye, underneath the nose, and then right on your chin, and then underneath your collarbone here. You can use one side or both sides. Underneath the arm, right under your armpit, and then on top of the head. And then this is an essential ingredient. After you're done with that round of tapping, you're going to inhale through the nose powerfully as you can, and then exhale through the mouth. Now I know that looks really dramatic and maybe a little silly, like you look like a monkey, but I guarantee you will get results when you use the tapping in the way that I'm going to prescribe you to for pain. So this week we're going to use this and prescribe it for pain, and I'm going to send you some other videos this month where we'll use the tapping for other symptoms as well, like anxiety, depression, because your body is meant to live in vitality. So tapping on the karate chop point, both of them together, or you can tap one hand on the other, and you're just going to acknowledge your pain. Okay, so it's a setup phrase. So you're going to say, even though I'm living with all of this pain, and now you're going to repeat after me. I choose to love and accept myself fully. And we're going to do that 3 times. Even though I'm living with all of this pain, I choose to love and accept myself fully. And then third one, even though I'm living with all of this pain, I choose to love and accept myself fully. Okay, inner eye. You're going to tap on one or both sides. I've been living in so much pain. This could be physical, mental, emotional. Just state it. I've been living in so much pain in the outer eye. And I acknowledge all of this now. Under the eye, it's been really, really hard for me. Under the nose, all of this pain I've carried in my body. And right on the chin, I am so ready to let go of this pain. Under the collarbone, but I just don't know what else to do. Under the arm, I know and I'm so familiar with this exact pain. And then on top of the head, this pain is destroying my life. All right, and inhale in the nose. Exhale through the mouth. Big shh. Hopefully you have a minute alone to do this because I get it. It looks a little weird. I just want you to gauge for yourself now how you're feeling in your body. Now, you either feel worse or you feel better or you just feel something different. Sometimes when we acknowledge the pain and the physical pain, and you can also tap on the location of the pain and the type of pain, how long it's been going on. After we've done the first round, you might feel some emotions come up, like frustration or anger or fear. So I'm going to get a little bit deeper into those because, like I said, every patient I've evaluated this way does have an emotional component to this. Inner eye, I'm so frustrated with this pain. Outer eye, and I'm also scared it will never go away. Under the eye, I'm angry, it's destroying my life. Under the nose, and I'm also starting to define myself by this pain. On the chin, and that makes me even more scared. Under the collarbone, I am so angry and frustrated. Good. Under the arm, dealing with all of this. On top of the head, I shouldn't have to deal with this pain. We're going to do a little more. Inner eye, and I'm so overwhelmed. Outer eye, angry and frustrated. Under the eye, and no one really understands what it's like. Under the nose, what this has been like and how hard it's been for me. On the chin, and so I am going to just acknowledge this myself. Under the collarbone, I see my journey has been so hard. Under the arm, and I'll meet myself with love and compassion. And then the top of the head, allowing my body to resolve in its own time. And take a big breath in. And then exhale out. Awesome. We could go a lot deeper with this and coming to a full circle completion, really meeting the underlying root causes. And this is exactly what I do in my group coaching programs. I'll be sending you some information about that down the road as well. But I want you to use this tool, use it any time during the day to address what's going on in your body. It's only those experiences that are unmet, unacknowledged, unloved, unaccepted, where we're resisting ourselves. And what you resist, what you reject in your body, it's going to persist, because what your body heals from most is love and acceptance. I hope that you've loved this mind-body tool using EFT Meridian tapping. I am so happy to address any questions you have and to help you further along your progression and living in vitality. This is Dr. KimDeramo from DrKimD.com. Please leave a comment below, because I'm so excited to connect with you more fully and offer you support. Sending you lots of love, and I'll see you soon.